Okay, I think we can get started. Hi, everyone. Thanks so much for joining us today. My name is Carrie, and I'm the project coordinator for protection at Interaction. I'm just going to go over a few quick housekeeping items before we get started. At the moment, it looks like we have about 50 people connected, 50 audience members. So due to the high volume, we have muted all of the audience members so that we don't have a lot of background noise. We're also asking that the expert speakers also mute themselves when you're not speaking, and we will do the same on our side so as not to interfere with the presentation. So if any of you audience members have a question throughout the webinar for one particular or even all of the expert speakers, you can use the question function that should be on the right-hand side of your screen. So you can send the question to me. We will collect the questions and comments throughout the webinar, and then we will set aside some time before closing to pose these questions to our speakers. So if also during the webinar you notice a technical problem or you have something else that you want to communicate with me, you can also use the question function to do that as well. So during the webinar today, we will include a few poll questions. So you will receive automatic prompts when we do this. So just keep an eye out for that. For your information, this webinar is being recorded and it will be available afterwards for those who could not make it today. And finally, to give you a brief overview of what's to come, Jenny McAvoy, our Director of Protection at Interaction, will begin with some opening remarks. She'll be followed by Ellie Kemp from Translators Without Borders, who will present their recent work and findings in Northeast Nigeria and in the Rohingya response in Bangladesh. So several expert speakers who Jenny will introduce will then engage in a dynamic discussion, which Jenny will moderate. So as mentioned, we will read out loud the questions from the audience for our expert speakers to respond to towards the end of the webinar. And with that, handing over to you, Jenny.
Thank you very much, Carrie. Thank you to Ellie and all of the other expert speakers who have joined us this morning or this afternoon or this evening, wherever you happen to be in the world. We're delighted to be able to host this webinar today and delighted that there's been such great interest across the world to attend this webinar. This discussion is part of Interaction's ongoing work to figure out what it takes to achieve meaningful and concrete protection outcomes. And by that, we mean an actual and measurable reduction of the risk that people experience in armed conflict, other situations of violence, and humanitarian crises. The critical starting point for concrete strategies to achieve measurable reduction of risk is to have a detailed understanding and analysis of that risk. And this means examining the issues in the first instance from the perspective of the people experiencing them. The process of engaging in analysis with affected people often yields the most practical solutions and is itself an empowering process. Overcoming language barriers itself often need to be part of the solution. One, because these language barriers may underlie people's vulnerability and their exposure to risks, but also so that people can engage directly with relevant stakeholders and be the agents of their own solutions as far as it is safely possible for them to do so. Principle 22 of the Guiding Principles on Internal Displacement says pretty explicitly, internally displaced persons, whether or not they are living in camps, shall not be discriminated against as a result of their displacement in the enjoyment of their rights. And this includes the right to communicate in a language that they understand. Given this, it's been surprising to us in the course of our work looking at results-based and outcome-oriented approaches to protection, how little we as humanitarians actually invest in effective communication and information flow with affected people. Humanitarian actors are often engaged in responses in highly multilingual environments, and yet translation and language knowledge is often overlooked. We're very fortunate to have the expertise of Translators Without Borders to shine a light on this issue and to have their advice to find a way out of this problem. We have a number of other expert speakers joining us in the webinar today that I'll introduce a bit later, who can share their practical field level experience as it relates to language barriers, communication, and translation. So this webinar discussion aims to explore the implications of multilingual communication in protective humanitarian action. We'll draw on case examples of forced displacement situations in Northeast Nigeria and in Myanmar and amongst the refugee population in Bangladesh. The situation will aim to identify realistic steps humanitarian actors can take to improve effective two-way communication on the risk environment that people experience in a manner that's consistent with results-based approaches to protection. With that, I'd like to introduce Ellie Kemp from Translators Without Borders. Ellie has been in the humanitarian field for nearly 20 years. She was a translator before she became a humanitarian. She worked in program and country management role for international NGOs for 12 years, including 7 years for Oxfam in the DRC and Sierra Leone. For much of the past 10 years, she's focused on humanitarian policy and practice, specifically on protection. And currently, Ellie leads the team that is scaling up Translators Without Borders work to overcome language barriers in humanitarian action. With that, Ellie, can I hand over to you and ask you to walk us through the status quo and the current problem as Translators Without Borders understands it.
Jenny, thank you very much, and thanks for the opportunity. So Translators Without Borders, not everybody's heard of us. If we can move to the next slide, Kerry. We're a non-profit organization, an NGO, which works to overcome language barriers to communication between affected people and responders in humanitarian action. So why look at language barriers in humanitarian action? Jenny's touched on that top line. I'd like to dig down a little bit into the issue of vulnerability. As a sector, we're really used to looking at factors, crucially important factors like poverty and gender and age and disability as drivers of vulnerability, much less so at language. And yet there's a connection here as well, because speakers of minority languages often experience multiple layers of disadvantage, from access to education and healthcare, to nutrition, to human rights and representation, access to technology, etc. And that means that minority language speakers can be some of the people that humanitarians most need to reach in an emergency, but because of the language, they can also be some of the most difficult. And each of these drivers of vulnerability compounds the next. So for instance, in many societies, women get less access to education and fewer chances to learn other languages. In many cases, older generations haven't benefited from the same educational opportunities of younger people, and may be less likely to read and write or be able to speak a national or other international language. Disabled people often suffer from poor educational provision in many countries, which can limit their communication options. And of course, the world over, poverty translates often into low literacy and less access to the languages of wealth and power. And all of that combines to mean that an impoverished older woman with disabilities who speaks a minority language could very often be the last person to find out what services are available to her in the event of an emergency, or where to go for help, or to be able to let responders know what she needs of them, or to report abuses. And this is an issue, if we can move to the next slide, is an issue for humanitarian action around the world. Many of the countries that are currently facing humanitarian emergencies are multilingual, and yet, as we all know, the humanitarian community operates chiefly in English. So we're going to look today of these many countries, many multilingual countries. The map here shows the number of countries in the outline of the country. We're going to look at Northeast Nigeria and the Rohingya crisis, which are two current examples where violence and displacement is linked to long-standing power dynamics and patterns of disadvantage which cut along lines of language. These are both cases where TWB is working with humanitarian organizations to support communication in the languages of the people affected. So to start with Northeast Nigeria, if we can change slide, over 1.9 million people are currently internally displaced by conflict. Some 7 million people are in need of humanitarian assistance. It's an incredibly linguistically diverse context. There are over 500 first languages spoken across Nigeria as a country, and more than 30 languages and dialects spoken by IDPs in the Northeast. And yet humanitarian responders have been using mostly just 2 languages, Hausa and Kanuri. An additional complication is that the long-standing marginalization of the Northeast means that literacy levels are low, particularly for women, which of course compounds the communication challenges. So moving on, we can see the impact of that. IOM's latest displacement tracking matrix survey shows that over 600,000 people, or 32% of internally displaced people, are not currently receiving information in their mother tongue. That's causing real problems for their effective access to information, especially for speakers of some minority languages like Marghi. Lack of information is reported to be a serious problem for a striking 51% of Marghi speakers. In Northeast Nigeria, we're working with IOM under an ECHO grant focused specifically on support to CCCM and MHPSS sectors. We're also collaborating separately with several international NGOs. Our focus has been on researching language support needs, training field staff in the basics of interpreting, and providing translation and terminology support in local languages. So to move to the Rohingya refugee crisis in Bangladesh, again, as an overview, here the language diversity is really on the side of the responder. All the refugees speak Rohingya, but that's a challenging language for the responders who speak a combination of English, Bangla, Chittagonian and Burmese. The biggest communication problem here has been an assumption by aid organizations that the Chittagonian language, which is related to Rohingya and local to Cox's Bazar, is close enough to communicate with the Rohingya refugees. It's not, as the examples on the slide here illustrate. There are critical concepts which are expressed very differently, which make for real practical problems for effective communication. The other challenges for communication are that it's an oral language without a unified script, and also that education policies in Myanmar have left a high proportion of the refugees with little education and low literacy skills. Women are also often confined to the home, which gives them less access to information and fewer opportunities to learn other languages. And moving on to the impact here, it is in essence a loss of effective agencies for the refugees themselves through a lack of information to make informed decisions. Here, TWB has a different model. We're working as part of a consortium with BBC Media Action and Internews to support multilingual communication with communities right across the humanitarian response. That is an advantage in that it allows for better coordination and economies of scale than focusing on specific sectors. The Common Service is funded by DFID and ECHO, and we're also working separately on sectoral terminology research and translation report to individual UN agencies and international NGOs. So what goes wrong here? I think we know, as Jenny said, that being able to communicate and receive information in a language that you understand is a right. It's a right in international refugee law, international human rights law, and in the rights of IDPs codified in the guiding principles. It's also enshrined in the common humanitarian standards. So we know in principle that it's important. And yet in Northeast Nigeria, in Cox's Bazar, and in many other contexts around the world, clearly humanitarians often struggle to uphold those rights and standards. And if we're going to make communication in the right language a standard in practice of humanitarian action, then we first need to understand how it ends up not happening now. And the first component of this is a lack of data. As a sector, we do not routinely collect information on the languages of people affected by humanitarian emergencies. When we're recording gender and age and household size, we don't systematically ask about language and literacy, for instance. And those organizations that do collect language data on occasion don't routinely share it. Also, there is no good reference point to start from because no complete data set on language exists that's authoritative and up-to-date and freely available. And that means that as a sector, if we want to know which languages we need to be communicating in to reach affected people, then we need to gather that information ourselves. And because we lack that data, we haven't factored language support into our program planning. So if we can move to the next slide, rather than planning and budgeting for professional language support or simply for effective management of our own internal language resources, all too often we rely on our national colleagues to do most of our interpreting and translating, largely without training and without guidance. And that is problematic in a number of ways. Without information on the languages of affected people, we don't know if our colleagues have the right languages to communicate effectively with them, as we've seen with Hausa and Kanuri in northeast Nigeria, or with Chittagonian in Cox's Bazar. Secondly, the public health promoters and M&E officers, etc., that we're asking to translate and interpret are not professional linguists. They were hired for their other skills. And yet the training and the terminology support that they would need to do that well are very much the exception rather than the rule. Finally, I'd say that translation and interpreting are generally tasks that are done in addition to the individual's day job. They're not valued and they're expected to do them on top of their normal job. And interpreting in particular can often be between two languages, neither of which is the person's mother tongue, something that we don't always take sufficient account of. So that's one aspect. One way that plays out, that over reliance on unsupported, untrained national staff, is that we don't always take the time to ensure that language barriers aren't skewing our data collection, the collection of the data that is that we need as a basis for analysing protection issues and humanitarian needs. TWB has been doing research in northeast Nigeria on this, and it suggests that poor language preparation for data collection, for data collectors, is having an impact on data quality. Typically in this context, and I think we all know in many others, surveys are site translated from English, and then the replies are translated back into English on the survey form. Our initial research has found that where enumerators are not well prepared, they understood fewer than 50% of key terms in the survey questionnaires that they're actually administering. In the case on the screen, this was with terms from the public health and shelter sectors. So far, almost all the enumerators that we've surveyed to date have said that language barriers are a serious problem in our work. We found in testing their comprehension that acronyms and technical terms are poorly understood. The way they end up dealing with it is that they call on members of the local community, including often children, to act as interpreters when they encounter a respondent who doesn't speak their language. Or they use a mix of basic Hausa and hand gestures, as one enumerator told us. If they can't find any way to communicate, they have no choice but to skip that respondent and move on to someone else. We have no way of knowing, because it's not generally recorded, how far people are being excluded from protection analysis and wider humanitarian needs assessment by language barriers. Clearly, organisations and teams vary in the importance they're already attaching to these issues. I'm not saying that this is universal, but there is every chance that these problems are not confined to northeast Nigeria. And so we start communicating with affected people without that basic understanding of which languages they speak and what the best combinations of language and format are to ensure the widest possible comprehension and to make sure that accountability mechanisms are accessible to everyone. We make assumptions, for instance, in northeast Nigeria, that it's been widely assumed that it's enough to communicate in Hausa and Kanuri as two big local lingua francas. Yet when you test that assumption, you find it's not true. We tested comprehension of very simple humanitarian materials among IDPs and host communities in Borno State. We found that 91% of less educated women didn't even understand very simple written information in Hausa or Kanuri unless they were native speakers of those languages. That means that if you're communicating in written form in those languages, you're essentially talking to the educated male native speakers. So even the most basic information about what assistance is available, how it can be accessed, may fail to reach the very people who need it most if we're not looking at language as a factor. Another issue here is humanitarian terminology. We've all had experience of it. If we can move to the next slide. It can be pretty impenetrable, particularly in the protection sector, I would say, even to native speakers of English in this English-dominated sector. Translating it into less vocabulary-rich languages, where many of the concepts are not commonly discussed, can lead to enormous confusion if there's not a systematic effort to ensure that the term is clearly understood and accurately relayed. One example of this was in Cox's Bazar, where TWB found that gender, a term which doesn't exist in the Rohingya language, was being translated as woman, and that led to gender-based violence being conveyed as violent women. Talk about lost in translation. In northeast Nigeria, we did comprehension testing with mental health terminology that you see on the screen, and it found that people's understanding is, unsurprisingly, no doubt, influenced by 9 years of widespread violence. So safe space was not understood in the MHPSS acceptation as a space where you can speak confidentially and without judgment, but as a place with armed guards. Similarly, food security was understood as a distribution off the back of an armoured truck. Worryingly here, 24% of people who listened to the terms in Hausa, and 17 of those who chose Kanuri for the comprehension testing didn't understand the standard translation for rape. Now, we can speculate about what the causes might be of that, but it suggests that further efforts needed to ensure that the concept is explained in very simple terms in order to avoid underreporting. Terminology is a problem for us as a sector. I think it's hard for us to give up our precisely defined terminology, and yet the simpler and more readily understood the words we use are, the better chance we're going to have of real communication across languages and cultures. And then, if we can move on, another important component of this is stigma. We need to understand the stigma that some terms carry in their standard translations. Again, in Northeast Nigeria, we found that the accepted translation for mental health was literally services for mad people. So a term absolutely loaded with stigma, which organizations working in the sector fear may be putting people off using mental health support services for fear of self-identifying as insane. In the Rohingya language, there's so much stigma attached to sex that there are a range of euphemistic terms used to describe sexual abuse, terms to do with villainy and dishonor and stain and oppression. They all have elements of abuse and force in them, but none of them explicitly express a sexual element, which make it very difficult for humanitarian professionals to determine the exact nature of the abuse. Evidently, the words that we use around such sensitive topics as violence, abuse, and vulnerability will often carry stigma, and we need to be alive to that possibility and find out how words are used and understood in the languages of affected people if we're to have conversations on these issues with them. And finally, we can move to the next slide. The question is where we go from here in that case. I've tried to describe here how, when we fail to take language into account from the outset, by first finding out which languages and formats and channels are best for affected people to communicate with us in, how language barriers then become a major problem. They can reduce our capacity to listen to affected people and be responsive to their needs and concerns and experiences. And they can limit the capacity of those affected to make informed decisions, access the support available, and hold us to account. The good news is that we have found from our work with partners in Bangladesh and Nigeria and elsewhere that when we do start from an understanding of language and communication needs, that we can find practical, workable solutions to turn that around. And I'm really interested to hear in the following discussion about the good practices and solutions and experiences of other organizations in these contexts and also in other humanitarian emergencies. Thank you very much.
Ellie, fantastic. Thank you for that great overview, identifying a number of really interesting and critical challenges. It sort of strikes me that these are the kinds of things that we should have been aware of for a long time. But in fact, it's your detailed research that's uncovering really, really valuable insights. What we'd like to do now, before we turn to our other expert speakers, is do a couple of very quick polls amongst the participants in this webinar. We're going to pose a poll question for you on your screen. Is it posted? There we go. There's the poll. You have 15 seconds to respond. In your experience, do humanitarian organizations consider language as a factor of vulnerability in their protection analysis? In your experience, yes, no, or I don't know. We'll give you a few more seconds to respond to the poll. And we have 55% saying no and 36% saying yes, 10% saying I don't know. Let's try another poll question. Does your organization gather information about the languages your target groups speak and understand? So your organization, yes, no, I don't know, or it isn't applicable to me. Here's the second poll, and the results are coming in. We have 48% saying yes, 25% saying no, and 8% saying I don't know, 18% saying it's not applicable. Okay, so I think we have some interesting reflections there from the participants in this webinar on the problems that you just outlined, Ellie. What I want to do now is turn to our expert speakers who are on the line to reflect in particular on what kinds of solutions and practical approaches we can be putting into place to cope with this issue. The first is Mia Marzotto. Sorry, Mia. Mia is the Senior Advocacy Officer at Translators Without Borders and has supported field teams from Maiduguri and Cox's Bazar in recent months. Her past roles include working with Oxfam on media and advocacy in the Palestinian territory and Israel, and on humanitarian advocacy and campaigns in Europe. She's currently based in Cox's Bazar. Tiffany Eastholm is currently Director of Nonviolent Peace Force. Prior to taking on this role, she served as the Director of NP's program work in Middle East, South Sudan, and Sri Lanka, and as the head of Peace Brigade's international program in Indonesia. Tiffany has long-standing interest in civilian-led protection strategies arising from her research and professional experiences in Latin America and Sub-Saharan Africa. Noreen Omondi is currently the protection coordinator at IRC Nigeria, based in Maiduguri. She is a human rights lawyer with experience in project management, protection programming, research, M&E, documentation, and youth involvement in governance and leadership, and transformational justice. Prior to IRC Nigeria, she worked with Danish Refugee Council in Tanzania and IRC and Africa Humanitarian Action in South Sudan. Virginia M. Moncrief. Virginia is currently the advisor for accountability to affected population at IOM, based in Cox's Bazar. She is currently a community engagement and accountability specialist specializing in L3 emergencies. Can I just check, Virginia, that you are indeed on the line now? Is she unmuted? Did you unmute? Yeah. Okay, I don't think we have Virginia yet, so we'll press ahead with Mia, Tiffany, and Noreen. Mia, I wonder if we can start with you. Seeing how broad protection concerns can be and the importance of understanding risk based on people's own experience of their threat environment, what data would you say organizations need to have about language and about how people receive and communicate information in order to carry out a protection analysis?
Yeah, hi, good evening, everybody, and thank you so much for the opportunity. So, well, I think that I might be repeating here some of what my colleague Ellie just said, but I think there are two key pieces of information or data that are definitely necessary. One is information on the languages people speak and understand, in order to ensure that we can listen to the experiences of the widest possible section of the community and develop accurate and inclusive protection analysis. And the second piece is information on people's communication preferences and information access. So this is necessary to develop a conflict-sensitive communication strategy that avoids talking only to the more powerful groups or to those who might have access to more information tools or the ability to read and write in the main languages, as Ellie was saying. And so it requires really thinking of language about as a key aspect of the communication and information ecosystem in a response. And I would add that the good news is that the data collection capacity of the humanitarian sector is there, and thanks to it, it's relatively easy to collect this data. So, for example, in TWB's experience, we've been working with IOM in Northeast Nigeria, as Ellie was saying, and since July 2017, through the IOM displacement tracking matrix systems and surveys, we've been collecting key information on language and communication at site level. And now service providers in the area can consult the data on TWB's communications dashboard. And this identifies key factors such as the primary language of site residents and their preferred format of communication. And it's obviously a big step forward for planning communication with internally displaced Nigerians at those sites. And the comprehension studies of the kind conducted by TWB can further enhance responders' understanding of language and communication needs. So that is definitely an additional element to the data per se to consider, particularly when we're talking about certain topics that carry stigma, when language and word choices really do matter and can impact our ability to carry out accurate and inclusive protection analysis. And one other point that I might make in answering this this question is that we should also be thinking of this as a matter of preparedness. So we need to be asking the right questions, but also doing so in the right languages. We need, as humanitarians, we need some basic information on the languages people speak, beyond just the simple answer, oh, it is the national or official language in the area, which we know are bound to exclude some groups. So this basic language information is key to getting initial data collection right, to then inform protection analysis and needs analysis as well. And it means challenging some assumptions and questioning, again, the first answer you get to the question of what language should be used in a particular response. And in that way, we can make sure to have enumerators with the right language skills and prepare for data collection in a way that caters to the needs of a multilingual population.
Mia, that's incredibly interesting, and it's really gratifying to hear you say that the data collection capacity is there. It simply needs to be oriented towards, a very deliberate and conscious approach to collecting that data, and I think a really valuable point on preparedness as well. Turning now to Noreen, so one critical issue in the Nigerian context currently is whether IDPs have sufficient information to make free and informed decisions about their potential return or relocation. Reflecting on what Mia just said, what do you think is important to take into consideration in order to ensure IDPs receive relevant and accurate information in a language they understand? And also, what about people's ability to communicate their expectations and their intentions regarding return and relocation? Can you tell us about the particular translation challenges as it relates to this issue?
Yeah, thank you so much, Kerry. Good afternoon, everyone. So Nigeria is a very interesting context. But until recently, just dealing with the usual emergency response, and then everything just changed, and all of a sudden we started having to change focus to a huge number of returns. Some of them are voluntary, some of them non-voluntary, forced by the government, and some of them were because they were getting attracted to the services that were being provided by the humanitarian actors. In terms of beneficiaries being able to make informed decisions, in Nigeria, basically, the humanitarian actors didn't have sufficient time or enough proper platforms to discuss the issues of returns. And we've seen a lot of challenges in terms of collecting information from the beneficiaries on the intentions to return or stay. Ellie and Jenny said earlier that for us to have quality analysis, it means we have to obtain accurate data, and the only way we can do so is to make sure that we are having effective communication, which is two-way with our beneficiaries, and this has to be done in a language that they understand. So this takes me to some of the challenges that we've been facing in terms of collecting data and analyzing these data. we are using a lot of enumerators, and some of these enumerators, like it was earlier said, speak in English, and the tools that we're using to collect information are also in English. So by the time they go to the field, they have to either translate in Hausa or Kanuri, and if it's another language, or if they don't understand Hausa or Kanuri, they have to get a third party to do the translation for them. And of course, that means a lot of information is lost during translation. So our staff who conduct regular protection monitoring, most of them looking at the capacity of the people in the Northeast, we tend to outsource a lot from other states. And this naturally means that these are not indigenes. Most of them cannot speak Kanuri, they cannot speak Hausa. So we rely heavily on the local populations. And this, again, has a lot of challenges because a lot of words are being misinterpreted. Beneficiaries also have a challenge on how to relay their information. I think that we don't have sufficient channels to do this. Currently, if you look at what is happening in the election period, and a lot of beneficiaries are very scared of speaking out about their intentions to go or stay where they currently are, because they have this fear of being reprimanded. So it would really help if we had like functional feedback systems that would take into account the different languages that we have in Northeast Nigeria, that are able to uphold confidentiality and are able to come across to beneficiaries as being confidential channels that they can trust and relay their intentions to stay in their current areas or return to their homes of origin. So I believe the way forward is for a lot of the humanitarian organizations in the North to invest in two-way dialogues, invest in getting information from beneficiaries, making sure that we are getting this and we are getting this and in languages that they understand, and we are also being able to provide feedback in ways they understand. Are we using channels that work for them, or are we using the normal channels that we are used to? We are just printing IAC materials, we're just going for awareness sessions and using the usual Hausa and Kanuri. What do the beneficiaries actually prefer? How do they prefer to receive this information? So yeah, I think a lot still has to be done in Northeast Nigeria into taking account the other 28 tribes, so to say, because we only focus on Hausa and Kanuri.
Noreen, thank you for that. It's incredibly interesting that, you know, even with Translators Without Borders data on languages used and preferred formats in the context of the Northeast, the next challenge, as you described, is actually constructing the methods and the channels whereby information can be conveyed and communicated and so on. So yes, you know, the challenge is not simply determining the language preferences, but then building the channels that accommodate that. Tiffany, I wonder if we can turn to you now and reflecting on the particular approach of Nonviolent Peace Force to community level engagement and reducing the risk of violence. How does language factor into your methodology for analysis at a community level?
Thanks, Jenny, and thanks for having me on here. I mean, our work is entirely based on communication. So our approach in terms of violence reduction and civilian protection, the foundation of it is relationships, building trust, building acceptance, and dialogue. So it's a critical issue, a huge issue, and something we sort of talk about, struggle with, and try and continue to improve on throughout everywhere we're working. I mean, I think a few sort of things come to mind when I think about this question. in many ways, it kind of forces us to slow down in preparation because we can't be terribly effective. We can't do what we need to do until we have got some really effective level of communication in language and the words and the way words are used and the way sort of the broader aspect of cultural communication is factored in. So we always say for us, like, relationship building takes a lot of time, and it can feel like it takes months before we feel like we're, really starting to achieve what we're trying to achieve in any given community, be outside sort of an emergency context. We really intentionally build in a lot of informal time, sort of with community members, with our local colleagues, and part of that is done quite intentionally to strengthen our ability to be able to understand how information is communicated. I can think of so many examples of where, learning from our mistakes, where sort of issues related to the tense will really impact something. Somebody will be telling you a story about a situation, a violent thing that happened to them or their community that happened, and in different countries, depending, the way that they use the tense of the language, it gets translated back and it sounds like it happened yesterday or last week, and really it happened 10 years ago. And of course that really impacts how we engage. Really thinking about working out definitions. Whenever we're in a new community, we start to, our name, Nonviolent Peace Force, is hard enough for native English speakers to wrap their heads around. So trying to figure out what the way to convey that messaging is. Classic example, of course, in South Sudan, is we are consistently referred to by local colleagues as non-peace violent force. So we can see that things go wrong very easily if we're not particularly careful. So really working out sort of terms and definitions that relate really specifically to our work, and winning some, losing some in that area, sort of trying to not fall into the trap of the humanitarian lingo, but that is much easier said than done. I think the process of language and preparing for both the assessment, analysis, and implementation really strengthens our relationships with our local colleagues. Sort of in the very early days of NP, the local colleagues, they were consistently sort of across the board, their title was language assistant. So you had the international sort of quote unquote protection expert or officer, and working with a local language assistant. But because of the way that our work evolves, and that how the local colleagues end up sort of, the goal for sustainability is they sort of become the leaders in peace and security, nonviolent peace and security in their communities. It's really become a much more comprehensive role that has language as part of it, but also is about sort of being representatives and direct implementers of unarmed civilian protection. And I was sort of struck by Ellie's comment in earlier about really being more considerate and aware of recognizing that those two things can be an extra burden. So I think it strengthens the relationship and role, but the role that the local colleagues have. Also, I think we all know, it really narrows the pool of who we work with. Our local colleagues have to be English speakers, or and have to have some function of English. It doesn't have to be perfect. And so I think that's something we all struggle with. And some of the side effects, positive side effects, for working through multiple languages in our work very specifically, we do a lot of dialogue and sort of facilitate local level mediation, is that it can actually slow the process down and take the heat out of a dialogue. If there people are upset or angry, and we're facilitating intercommunal dialogue process, having to translate through 1, 2, maybe 3 languages gives pause for thought, and often it sort of takes the emotion out of the heated emotion out. So we gain some things, we lose some things in nuance. We've started to use more and more graphics and cartoons and illustrations, and we're finding that to be helpful, not only just for language in and of itself, but also around literacy issues and challenges in some of the areas that we work in. So it's a constant challenge, and I think that there's no easy solution, but these are some of the things that we consider going into it.
Tiffany, again, incredibly interesting and a unique perspective based on NVFP's work. Sorry, see, I even got the acronym wrong. Really incredibly interesting insights. I wonder now, Mia, if we can turn to you. How do you think we can best ensure that effective two-way communication genuinely exists? And I wonder if I can ask you to also reflect on, how we can actually be tracking that through program implementation in order to ensure that we are being effective in information flow, and how we can assess and continually monitor whether the right people are receiving the information they need in a way that they can understand.
Yeah, thank you for that question. So I think for TWB, effective two-way communication really means meaningful communication. And this entails recognizing the fact that language is a key component in meaning and in understanding whatever communication we're talking about. And as humanitarians, we tend to talk about communication with community as if the community in question is a homogeneous or monolithic thing. And at the same time, we all know that this is rarely the case. And language is also not a monolithic thing, but it shifts and evolves. So there can be really no one-size-fits-all solution for communication and two-way communication and community engagement. So I think there are 3 key components to effective two-way communication that any aid organization should be able to apply. The first, as we were saying before, is collecting language data as part of regular needs assessments. And I stress the word regular because it's not only a matter of initial assessments, but I think we need to recognize that information and communication needs and preferences might evolve as a response evolves. We've seen this in the Rohingya refugee response, for example, when where we've in the past year there have definitely been tremendous improvements in access to information. However, while people report having access to enough information about certain services, there are still critical information gaps when it comes to access to information for and two-way communication for decision making around key topics such as staying safe during heavy rainfall, or even more challenging topics such as voluntary repatriation and other longer term issues. So yes, so the first action is definitely collecting that language data regularly and using it as a basis for effective communication strategies. Second step would be building language support such as interpreting, translation, and terminology development into program plans and budgets and training needs assessments. So as I think both Noreen and Tiffany earlier remarks alluded to, it's important to be able to use that data and have the right capacities, and that means having the resources, the budgets to do so. And I think the first step is ensuring that whatever materials, whatever communication tools are developed are clear and using simple language to ensure the widest possible comprehension, so that those misunderstandings of acronyms or technical terminology do not get in the way of people to be able to communicate genuinely and effectively with responders. And actually developing such tools and systems collectively in a coordinated approach is quite effective as well. So as Ellie was mentioning earlier, in Cox's Bazar, TWB is working in a consortium with the BBC Media Action and Internews, and together we provide a common service for community engagement and accountability. And from a language standpoint, we have learned that it makes sense to build the library of materials in the right languages and formats that all service providers can draw on. And it also makes sense to provide social linguistic guidance and language capacity building support across sectors and organizations. So it's all responders that can make use of these tools, and at the same time, it's the appropriate community feedback mechanisms can be put in place collectively so that all affected populations can have access to them. And to give probably a more specific example of what this actually looks like, in Bangladesh, for example, our terminology development support work, it includes a glossary, which is a tool that helps people communicate across the 5 languages in the response, so Rohingya, Bangla, Burmese, Chittagonian, and English. And the terms included in the glossary range from gender issues to WASH to disability and inclusion. And as part of this terminology development support work, we have also trained around 400 field workers to use the glossary. And in the process of developing the glossary, we have learned many key bits of information, such as the fact that Rohingya women have a socialect or a social dialect of their own. So words that women use, particularly in relation to the female body and sexuality, are not understood, not even by the men in the Rohingya society itself. So having that understanding and making sure that we're using the right words when communicating can make sure that communication is effective and is genuine in terms of using words that people really understand, that do not carry stigma, and at the same time convey as much as the meaning as possible. And so yeah, so the feedback that we've heard from partners has been that the reason why this type of support is really helpful is not only that the glossary is a freely accessible tool, and that it identifies correct words in each language, but it also helps to respect certain cultural sensitivities around particular terms and topics that can be sensitive and delicate to discuss with communities.
Mia, again, incredibly interesting. Thank you for that. Tiffany, I want to come back to you on the methodology of NP. I mean, you do a lot of work so that communities have the capacity to engage directly with duty bearers and advocate for themselves. And I think you started to speak about this earlier, but I wonder if you can take it a little bit further. Are there ways that humanitarian actors could facilitate this better, this direct engagement by affected people with duty bearers, recognizing that that relationship may be hampered by language barriers as well?
Yeah, sure. I mean, it really depends context and sort of what that a barrier looks like. So if we think about something like the Sri Lanka context, going back a little bit, when government services were provided only in Sinhalese and Tamil people couldn't access, either because they couldn't understand or weren't being served. So where it's a state policy issue versus a displacement issue, like the situation of Bangladesh, where you've got populations coming together, needing to access duty bearers, and who may not speak their language for different reasons, for more, frankly, more innocuous reasons. So, I mean, things that, we work on are things like, in the accompaniment really helps if there are sort of parties that are such as, somebody from an international non-governmental organization, accompanying community members to be able to see the duty bearers, where not only translation can be provided, but also sort of just that it shines a light of importance on their presence there. Often they get better served, there's better attention paid. I think there's a lot of work that needs to be done in terms of high-level advocacy as it relates to this issue, because, I mean, we can work really really significantly with the communities, those who are experiencing greater vulnerability and really needing to advocate for themselves and really help them learn the language of the duty bearers, not just the actual language, but the terminology that's used. Often that opens doors in a way that can be quite useful. And then sort of the higher level advocacy pieces for the relationship in the other direction. I think relationship building, we do quite a lot of like really local level bringing together of duty bearers and community members through things like community security meetings where members of the military or local civil authorities will sit down, literally sit down at a very grassroots level with really, and we target a lot of that at work is targeting women who can come forward and share their concerns, and then we have translators available. Some of the key issues, of course, are around perceptions and neutrality. If your translators are coming from the local community, particularly the community that is experiencing and the increased vulnerabilities, their translations may not be accepted or considered neutral. And so is it a translator who the authorities respect? And, so I think sort of thinking about having pools of people available that we could draw on in those situations that sort of are considered more neutral. And, certainly a lot of more training around sensitivities. Translations of materials, and I think there's quite a bit of that happens around sort of code of conduct and duty of care and commitments, deeds of commitment that parties have made to various protocols and so on and so forth. But I think it's definitely one of the more challenging areas because not only because of the language barrier in and of itself, but because the extraordinary power imbalance and extraordinary power differential that can't be overcome simply through translation. It's sort of a whole package of things. Language is just one piece of that.
Excellent, Tiffany. I mean, I think it would be really fascinating to devote some attention, particularly to terms that help communities engage with duty bearers. Sounds like a really interesting project, hint, hint, TWB. So now coming back to Noreen, I mean, as organizations invest in language and translation, inevitably we're going to start becoming aware of things that should impact our approach to addressing protection concerns. Do you think we, and by we, I mean the humanitarian community in general, do you think we are flexible and adaptive enough to make use of the new information, the new insight, our new understanding of people's perceptions and expectations in order to use this new information and adapt appropriately?
Thank you. That's a very, very difficult question because it means I'm supposed to be answering on behalf of everyone. But I think that it's becoming very clear that overcoming language barriers is very key to any humanitarian response. And from a protection perspective, protection concerns are generally not static and they keep on changing in every context. And that means we have no option but to make sure that we are having, when incorporating flexibility into our programming. Of course, there are challenges when it comes to trying to be very flexible in our responses. The internal structures we have in our organization sometimes limit us. Donor requirements also limit us. But that being said, a good protection response or any humanitarian response should be risk informed. So that basically means any response should be flexible enough to respond to needs as they arise, to respond to the regular protection risk analysis that we conduct. Another challenge would be, and this is in the Nigerian context, we have a centrality of protection strategy, which will be a good entry point, but as it stands, we still have teething problems and it hasn't been operationalized as of yet. So I believe there's still they still need to invest more in putting protection at the center of the humanitarian response in Northeast Nigeria. But to answer your question, yes, I believe we have the capacity, and I don't think it's something that we should be gambling about. Not focusing on the language barriers basically just exposes our beneficiaries to a lot of other protection risks, which is one of our main principles. We are not supposed to expose them to further harm.
It's really interesting, Noreen, that you referred to the centrality of protection as a potential vehicle to push and prompt the kind of adaptive and flexible approaches that are needed. It's not just a single organization that needs to be adaptive and flexible, but the collective of humanitarian organizations to really have that mindset and that posture, and to absorb the new information coming out of the investment in translation. So thank you for flagging that to take into account. So we want to take another poll from the audience, and we're going to ask you the same question we just asked Noreen. And that is, do you think humanitarians are flexible and adaptive enough to make use of the new information and analysis coming out of translation and to adjust programming appropriately? Yes or no, or I don't know. We'll give you about 15 seconds to reflect on this and choose your response. Interesting. So we have about 30% saying yes, we are flexible and adaptive enough. We have, the numbers are still going up and down. Yes, about very evenly divided. This is interesting. So 30% say yes, we are adaptive enough. 37% say no, and 31% say I don't know. So yet another challenge that potentially we need to be looking at as it relates to not just investing in the language, but also the implications for how we work and how we program. Mia, I want to come back to you again. Now, some organizations, and this speaks to the collective capacity a little bit more, some organizations have expressed concerns about sharing language data. Can you walk us through what the issue is and what some of the concerns are, and potentially how we can mitigate or address some of those concerns?
Yes, sure. So thank you very much for the question again. I think that there are a few concerns, and they're definitely all valid ones. The key issue really relates to the fact that there is an obvious link between language and ethnicity, and therefore potential backlash against affected people on that basis. And this has been mostly raised in issues or in situations involving refugee populations, where the language people speak is taken as an indicator for country of origin or their ethnicity, and sharing that information might put people further at risk. But at the same time, I think we need, as with everything, to balance the risks of sharing information with the risks of not sharing it. And in my opinion, and in TWB's experience, we think that we should be looking at these risks and these concerns on a case-by-case basis, and come up with a workable solution that is in line with protection outcomes and protection principles. And so I think we should be flexible enough to have protection specialists be involved in assessing these risks and in designing mitigation measures. One potential solution, for example, going back to the data collection discussion that we were having earlier, would be to collect household level data, but share only aggregated data analysis and identifying the language and communication needs, not at a household level, but at a site level or at a broader level. And that way, organizations would still have access to data to inform effective communication strategies, but not put at risk individuals. And obviously, just as a general statement, good practices on information and data management are also key, of course. And yes, in taking a case-by-case approach involving protection specialists, I think could be good ways of mitigating these concerns.
That's interesting, Mia, and indeed a reflection of the broader concerns around sharing data on sensitive issues and the potential implications that you may have. But as you pointed out, we need to assess the risks and address them rather than avoid them. So I want to reflect a little bit on how we can understand the implications of language when we're evaluating protection outcomes. And Ellie, I want to come back to you on this question. So say you and I, Ellie, were going out to evaluate a program and determine whether a protection outcome had been achieved, and say that we were looking at the contribution of language and translation in the program being evaluated. What would we be looking for, and what would some of the indicators of effectiveness actually look like?
Thank you. A tricky one for sure, but I think ultimately you're looking at a number of the factors that the various speakers have raised. One aspect, depending on the type of program, is going to be about comprehension. Do minority language speakers or literate and illiterate individuals, for instance, know what services are available to them? Know what their options are for return, for instance, in the Nigeria context. So you could be looking at indicators around information being made available in languages and formats that prior evidence suggests will reach the widest possible group, including those groups that your protection analysis has identified as vulnerable, and then indicators on actual tested comprehension and knowledge by, for instance, gender group and gender and language group and gender and literacy level. So you're adding a layer of language and literacy to the kind of indicator you'd already be taking on board. In terms of, there's an issue around ensuring that we are hearing from all sections of the population. So for instance, if you're looking at a protection outcome around people feeling less at risk or safer, then we'd look at whether people's views had explicitly been sought on that across language groups, and explore how, for instance, the communication channels open to certain groups might affect whether or not people feel or experience safe or at risk. In terms of some of the issues that Tiffany was raising about neutrality, there can be a problem to be explored in the delivery of programs and the evaluation of their impact around that. Do people, for instance, people from specific language groups feel that the interpreting support provided is confidential? Do they feel able to talk freely through that interpreter? Often we know that there aren't enough female interpreters to discuss particularly sensitive issues, but also Tiffany was raising issues of the political or ethnic affiliations that an interpreter might have. And then feedback mechanisms, if we're looking at whether language and communication related factors present obstacles to safe access to services, we could consider whether the feedback mechanisms that are provided for allow for speakers of marginalized languages and allow for non-literate people to report abuse or misuse of aid. So I think those are, it's about being explicit about language and related literacy and communication issues in relation to comprehension, in relation to knowledge, in relation to the channels of multilingual communication, and yeah, factoring that in, I think, to all of your indicators, and looking to see whether that language has been taken into consideration in gathering the information for the evaluation, so that that a cross section of the community has been consulted.
Thank you for that, Ellie. So just to ask a follow-up question on that, do you know of any evaluations that have been done which incorporate the dimensions that you just talked about? And if not, then I think this is something really important. I mean, I can't underscore enough the extent to which you know, we as a protection community in particular, I think, have not sufficiently invested in evaluations, and you know, therefore we're missing all of the learning that can come from evaluating, particularly at an outcome level. So I think it might be interesting, hint to the operational and implementing organizations out there, or even a group of organizations doing this together, you know, to evaluate some of their protection work, evaluate whether protection outcomes were achieved, and you know, build in the language indicators and parameters that Ellie described. I think that would be of huge benefit beyond you know, individual organizations. I think we'd learn a lot from it collectively. With that, let's now look in a little bit more detail at organizational and collective capacities to do the kinds of things and address the challenges that we've been talking about today. And this question is to Noreen, Tiffany, and Mia. I mean, human and financial resources are essential in you know, for all the things that you've outlined. And to reach the kind of operational capacity that's essential. How should organizations invest in translation collectively? And what are the challenges and implications of this? I think you've all alluded to a range of human resource challenges. But I wonder if you can talk a little bit about actually making those investments at organizational and collective levels. Noreen, I wonder if we can start with you.
Yeah. Ellie said at the beginning that there's we heavily rely on national staff to do most of the translation work within our organizations, and this is a group of people who already have other tasks that are they're supposed to do. So essentially, this means that either they're being overworked, or two, they also don't have the capacity to effectively ensure that we are reaching each and every language group, especially the minority groups who are more vulnerable. So I would think that it's very pertinent that as organizations will start thinking in investing in interpreters, and this can be we have a very good pool of people who can provide these services, and these are basically people within the localities we work in. So instead of maybe engaging them on an incentive basis, we can give them packages that would motivate them to do their job. So basically, it will mean us including people who are going to ensure that we are responding to all language needs of our beneficiaries, into our planning, into our budgeting, into organizational structures and organograms, and having clear job descriptions for them. I think the beauty of this is that we have donors increasingly also appreciating the need of overcoming language barriers. But a lot still needs to be done. And this is the first time we've had a lot of discussions around language issues. And this only started when TWB came into Nigeria. So it's a good forum. It's a good opportunity for them to keep on pushing so that it's not only the protection actors who are really focusing on ensuring that we are overcoming language barriers, but also other sectors are doing the same, and other donors are also understanding the need to overcome these barriers, so that the responsibility doesn't only seem like a protection responsibility, but an overall responsibility that falls on everyone.
That's great, Noreen. Tiffany, do you have anything to add?
Yeah, I mean, I think we could look at even things like common equipment. Translation equipment is so expensive, or equipment for interpretation for things like workshops and conferences, rather than us all investing in that. I was thinking really about this training, putting more emphasis on training for our international staff in local languages, recognizing, of course, that we're not going to achieve fluency, but at least some sort of basic level competency, if nothing, to sort of facilitate the relationship building and an awareness, and for everybody in intercultural competencies, rather sort of looking at it again beyond just the language itself, but the way language is used and all the pieces that go with it, because a lot gets lost in translation, not just because of the languages that we're not getting, but because of the intercultural nuances that we're missing. Whether from an investment point, just a common thing that we all often talk about is billboards and T-shirts are almost always in English. If messaging about domestic violence and washing our hands in English was working, then we would have a lot safer people and a lot less diarrhea. So we know we need to work on that, and things around sort of the roles of power and gender in the use of so training in that area, in the use of language. I can think of many examples where a female community member, spoke for a good 5-10 minutes, and then the male translator spoke for about 2 minutes to say what she had said. And, we clearly had some issues to work on there. So I think, Noreen, I agree with what Noreen is saying about sort of common pool, and if we could sort of build up some common assets in these different areas, that would be great.
Thank you for that. Mia, anything to add?
Well, I think what both Noreen and Tiffany have said resonates a lot with our experience and with our advocacy messaging, definitely. I think that it from a translation point of view, it obviously makes a lot of sense to collectively invest in translation capacity, particularly for underserved languages for which there might be very few translators and trained interpreters available. So again, the common service model that we've been working on together with BBC Media Action and Internews in Cox's Bazar is a good example of providing free specialized agencies providing a service that obviously goes beyond just the translation, as translation is only one part of what we do to really ensure effective community engagement and accountability. I think the other point is in terms of like HR implications. We should definitely be talking more about capacity building. One of the core one of the core activities that TWB is about is really investing and fostering and supporting communities of language practitioners. So building capacity as much as possible and supporting it as part of HR processes, but also beyond individual agencies and organizations within the broader communities in which responses and emergencies might be taking place. And from a financial implications perspective, if I can be humbly provocative, I would say that we don't have the like really bulletproof argument on the value for money of investing in translation and doing so collectively. But I think that all of the speakers tonight have raised some really good points and presented some really strong cases for which there should be more investment in translation and language capacity, and the truth is that we are already investing in communication and community engagement. We just have to be doing it in a meaningful way and making language considerations as part of standard humanitarian practice.
Thank you for that, all of you. We want to turn now to some questions that have been posed by people listening in today. And for that, I'm going to turn over to Carrie.
Thanks, Jenny. So thank you also to our audience members who have sent in these questions. For the sake of time today, I'm going to request that the expert speakers respond as concisely as possible so that we can get through a few of these. I'm going to group them together a little bit. So these first ones are aimed more towards Translators Without Borders. So Mia and Ellie, feel free to chime in. Could you please say more about your comprehension studies? Where do these take place? In what instances is such a study launched? And where can we access the results? Another question is on the translation tools or databases that Translators Without Borders has developed. So I'm aware of a few applications that you have. So could you please elaborate on this a little bit?
I'm going to try and be concise. Thank you very much. Great questions. Comprehension studies, we think they should happen in any multilingual humanitarian context. That isn't happening just yet, so they happen when we can find a partner that wants to work on it with us. We've implemented in a number of contexts, including the two we've discussed today, and also the European refugee response in Greece. The results are available on our website, that's translatorswithoutborders.org. In terms of translation tools, I think the most readily accessible tool, the ones most relevant for field workers, would be the mobile glossary apps that we develop, and there's one for each of these responses. Multilingual glossaries that you can download onto your phone and use with an offline function, with an audio voice function, so that you can to support communication with non-literate and second language speakers.
Okay, thanks, Ellie. Mia, did you have anything to add there?
No, I think we'll keep it as concise as Ellie was.
Okay, perfect. And the next question is open to all of our speakers, but maybe Tiffany, you could start. I believe Ellie touched on this in her presentation at the beginning of the webinar about the issue of language and stigma. So does anyone have any examples that you could share with us today?
Sure. I mean, I think I would say probably the one we most commonly share is around sexual violence and sexual assault. And I can think of an example where I saw a humanitarian organization who had headquarters visits happening, where their sort of senior representatives were speaking to people in a displacement camp and wanted to talk to people about their experiences, and went directly to a woman that they had been told the background story of, and it was a woman who had been, among many other things, had also been raped, and went up and wanted to meet her, and in the course of this conversation asked her directly if she had been raped, having met her not 5 minutes before. and with a group of people around. And of course, the woman said no. And the people who were there walked out of the almost disappointed that they had not met sort of a survivor in this case. And it just, it broke down sort of so much trust in that community and in that particular community-based group. And of course, the woman said no, and we all understand why. But I can think that's an extreme example. But around sort of stigmas related to those things, stigmas in terms of language that you inadvertently use when groups, whether it's ethnic groups or movements, freedom fighters, armed groups, whatever you want to call them, have particular groups, things like tigers and lions in Sri Lanka, sort of those kind of things. We so easily stumble into things that are incredibly offensive or injurious just through our lack of knowledge.
Okay, thank you, Tiffany. Does anyone else want to chime in on that one? Okay, if not, let's go to maybe one last question. This is a tricky one. I'm going to pose it to all of you. So we had somebody from the audience say, in their experience, they have encountered some situations where they have local or international staff or speakers who seem to deliberately not translate the correct words because they have their own biases and do not necessarily agree with some of the protection issues being addressed. So do you have any recommendations on how organizations or managers could handle this?
I'd love to come in if I can. It is a real problem, and it's a real problem for that neutrality and trust in and therefore effective communication that Tiffany was speaking about earlier. TWB has a handy guide that's available on our website in a number of languages, a field guide on the basics of humanitarian interpreting, which outlines some of the expectations that both sides, frankly, need to be aware of if it's to be an effective process. There are issues, what you're supposed to be doing, that you are meant to be a neutral channel for communicating, not interpreting what the person's saying or saying what you think they should have said. We assume that that's a given, and yet we're working with people very often that we've given no guidance to on that matter. And it's also important for the person working with them, the international aid organization, expat very often, to understand that they can't speak for 5 minutes non-stop in idiomatic English at speed and expect to be accurately relayed. So that's available. Face-to-face training is obviously far more valuable than a document for reference, but that document for reference is something that is available, and there are a lot of other resources available online, particularly UNHCR resources and University of Geneva resources that can offer training and tips for the quality of humanitarian interpreting.
Any other last comments on that last question?
Okay, well, thank you for that. Certainly at this end, we found it incredibly rich and informative, and I hope the same was true for everyone involved in today's webinar. Thank you to Translators Without Borders for your excellent presentation, and to all of the expert speakers for this very engaging discussion, and to all of the participants for tuning in today. We're going to now post a post-webinar survey. It's only 4 questions that will appear when you exit the webinar. You'll receive an automatic prompt. Please fill it out. We take evaluations and feedback very seriously here at Interaction, and we will use the input that you provide through this survey. With that, we'll close the webinar, with a huge thanks to everyone involved. This webinar has been recorded and the link will be circulated. So please feel free to share it with your colleagues as well. And with that, have a wonderful day, and looking forward to being back in touch with you through future events. Go to the
So